Hello. Hi, everybody. Let's get started about the most common questions about facelift I get. And that is both in surgery, from people that come and learn from me, in the office, from patients. When I go to conferences, there are a lot of common questions, but it's specifically three main ones that I think everybody's interested in knowing. Hope you're all having a good Monday. We just finished surgery. You can see I still have my hat on because now the hair is a disaster and I need to go home. Anyways, guess what is the number one question about facelift? Scars. Facelift is scars. No one likes a scar. Everybody's afraid of scars, but everybody wants to have the results. And for the results of the extended deep plane facelift, which is the technique I use for facelifts, we do place scars, incisions in very hidden areas of the face that allows us to lift the deep tissues of the face. This technique is not a skin pull. Nobody should be doing this anymore. It is a vertical lift, a vertical repositioning. So you can imagine when you're doing this movement, up and back, all that excess skin comes this way. So there are wonderful areas here to hide incisions, and that's where we go. So let me show you here on me. When we lift things with a deep plane, we lift the SMAS layer with the fat pads, which is really what sustains the face up in a good position over time. So you can see that all the incisions will end up on the side of the face, under the hairline, and around the ear, behind the ear as well when we do the neck. So the skin comes this way and this way. When patients have heavy necks and we need to take the fat out here from the double chin, or we need to remove glands when it's deep and bulky, when we need to tighten the muscles with a platysmoplasty, then we also have one under the chin, which stays nicely in the shadows of the chin. So one here to tighten bands, take deep fat, take the glands out sometimes, and one around the hairline, behind the curvatures of the ear, and in the crease of the ear, behind the ear, into the hairline sometimes. When we do the technique that allows us to close the incision with no tension, which is actually the best thing to do, we end up with beautiful scars, with very, very imperceptible line scars once they are healed. However, when there is tension or the patients have maybe some issues with healing, it can be a little more visible, but it's not that visible because the technique actually helps us a lot. Let me see if I can find you the incision to share with you of what it looks like. So look at this. We have here under the hairline, under the sideburn, this is the incision closed at the end of surgery, and then around the earlobe. And we have one behind the ear. It comes down into the back of the hair. And those are areas that heal amazingly. You see those sutures here through the skin? Those sutures are just very temporary sutures that come out at about 3 days after surgery, bringing the skin back down to the deep tissues to avoid healing and bleeding and actually make the surgery heal up faster with less swelling. Those are amazing things that we do, and we remove those sutures in 3 days together with a little drain that goes across the neck under the skin to remove all that fluid out as well. Questions about scars? Let me see. How long does it take to heal? Well, sutures stay in place for about 7 to 14 days after surgery. We start removing sutures actually, as I said, on day 3. And up to day 15, all sutures are out. There are very few internal sutures here. They're mostly on the skin level. There are deep sutures here for the deep plane and for the platysmoplasty. They are all absorbable, and the body absorbs that suture. Nobody sees it, and it ends up healing very well. Let me show you the healing on a close-up here. Oh, that one is not going to show. Let me just see if there is a better image to show you the healing of the incisions. Here, you can see that ear, that scar is right there under the hairline, around the ear, and you cannot see it. Basically, you know where they are right now, so maybe you can look very closely, but it's usually very, very imperceptible. And this is only 6 months after surgery, so it will get better as time goes by. What is the second most common things that I question-wise that I have in the office about facelifts? How long can I go back to my activities? Usually patients can go back to basically normal life at 2 weeks, except for intense physical exercise. Intense physical exercise usually at 3 to 4 weeks after surgery. But patients can go back to work at 2 weeks, usually doing really, really well. When we do eyelid surgery together with the facelift and the lip lift, that's when patients are most swollen, and then it may take a little bit longer for them to look kind of normal. But for a facelift, it's actually 2 to 3 weeks max. And when do we do other procedures with a facelift? The most common thing I do with a facelift is fat grafting. Fat grafting is transfer of the patient's own fat. We go there with a little tiny liposuction cannula, remove the fat, and then place the fat where patients have lost fat over time, usually around the eyes, but also here sometimes chin, nasolabial folds, mid-face. Those are the most common places we replace fat that has been lost with some fat. And that is permanent. All fat that stays in place and survives there, which is the majority of it, it stays there forever. But we keep aging, so we keep losing fat. So that will go down eventually. We have other things that we use, like Renuva. Today I use that in surgery together with fat grafting, because the patient was very skinny and did not have much fat. So Renuva is a fat matrix that makes the body produce its own fat, and I associate with surgery or just here in the office as a filler for patients that would like a little more permanent filler than just hyaluronic acid or other fillers that don't last as much. So I like that. I use that, and it's a very good product. Differences between wrinkle treatment and a facelift. Another very, very good question. When patients have a lot of wrinkles because they took too much sun, or they have too much movement, never treated with Botox, never did any skincare treatment, wrinkles, especially here in the center of the face, they don't go away with a facelift. You can imagine, we don't do this. We don't stretch the face to look weird. We lift the face, and this area here basically stays untouched. So here's where we do also fat grafting. We do chemical peels, we do lasers, we do skin treatments. Here in the office, we prepare the skin with microneedling, with lasers and other things to make the skin look good, because that's the icing on the cake. We lift and tailor the face with surgery, and we improve the fabric, the coating, the skin with skincare and skincare treatments. Soft wave for tightening and lifting a few millimeters of the skin is amazing for patients that don't want to do a facelift or for maintaining a facelift. Microneedling improves the texture, can improve fine wrinkling and pigment, and gives that vibrancy to the skin, especially with exosomes, which is a growth factor derivative we use for skin improvement, and lasers for redness, for pigment, for pores. Of course, home care is the most important thing, because what you do on a daily basis is much more important for skin care than whatever we do here in the office. If you don't take care of that afterwards, it really does not help much. You can improve some, but if you keep exposing your face to the sun and don't do the things you need to do to protect, it is really not a good investment of your money. So I think those are the main 3 things about facelift that I get as questions-wise here in the office. And I don't think we have any questions today. So this will be a short live, because it is the end of the day. Thank you for watching. It is a great day for us to start the week. Thank you.